the synthesis and uses of the metronidazole. So the student, it is one of the drugs, one of the important drugs, metronidazole. In these drugs, firstly, the synthesis is expected. In the synthesis, you have to prepare that particular compound metronidazoles. Then, uses of the compounds. These 2 points are expected in this question, the question format. So, the drug metronidazoles category is most important. Which category of the drugs it is? It is a generally category of anti-amoebic drug. Anti-amoebic drugs categories. That category is included the metronidazole. So what is related with the anti-amoebic categories? Have you heard the word anti-amoebic type of the drug earlier?
सर आवाज बहुत स्लो आती है.
बहुत कम आती है. हेलो, अभी आती है आवाज? हेलो.
यस सर.
अच्छा ठीक है, चलिए. सो एंटी एमोबिक ड्रग. अभी एंटी एमोबिक ड्रग्स जनरली काय के लिए यूज होते हैं, पहला समझना बहुत जरूरी है कि तो मेट्रोनिडाजोल comes under the category of the anti-amoebic drugs. So generally anti-amoebic drugs are used in the infectious diseases. Infectious diseases के अंदर ट्रीटमेंट के लिए यूज होती है. जैसा कि infectious diseases है जो कि प्रोटोजोन से होती है, ओके, और प्रोटोजोन्स के वजह से जो उसको रिस्पॉन्सिबल है factor, that is a Anti-Amoeba histolytica. It is responsible for the protozoan. So generally it is a primary effect, okay, and generally it is affect on the colon. Colon means the intestinal parts. Generally it affects, and other organs may also be affected. That is the secondary stage, like the liver also affected, lungs also affected, brain also affected, okay. So this, in this types of the diseases, generally the metronidazole drugs are prescribed by the doctors. So how we can prepare this metronidazoles? So that is the important part. So here is the synthesis procedure is given. Okay. In the starting, we have to take the glycol as a starting materials. Glycol reacted with the ammonia, two molecule of ammonia and acetaldehyde. And this is the name reaction, that is a T.Y.B.Sc synthesis types of the reactions, which gives the next products, okay, intermediate, that is 2-methyl imidazole as the intermediate, which is reacted with the HNO3 nitric acids, okay. Cyclization takes place, substitutions at the first position takes place. After substitutions, okay, substitution reactions, we react with the ethylene oxides, then we will get the final product, that is the metronidazole as a final products. So in the metronidazoles, their OH group is also attached and NO2 group, two functional groups are attached in this case, okay. So generally photostat metro fourth, it is the anti-amoebic and the belonging to imidazole class, okay. So it is important anti-protozoonic drugs, okay, and which is used for the treatment of the uh, important in the treatment of the antiprotozoans, treatment of the antiprotozoal infection diseases. So metronidazole is orally effective, okay, in the both the acute and the carrier states, and the anti-amoebic activity is effective against the both intestinal and the hepatic amoebiasis. So these are the uses of this anti-amoebic drugs. It is the metronidazoles. The metronidazole structure is also important. It is having some side effect also. That is the abdominal pain, anorexia, metallic taste. Okay, these are the side effects are also associated with the metronidazoles. This again, it is effective against the, both the intestinal and hepatic amoebiasis. It can also be used against the other protozoan infection like the giardiasis and the blantidiasis. Next is the, that is the, what are the symptoms of the AIDS? Okay. The long form of the AIDS is the acquired immunodeficiency syndrome. Okay, so AIDS itself it's not a separate disease because of the AIDS. This is like a cold. Okay, so AIDS is associated with the groups of the number of the diseases. In this case, what happens? Generally, in case of the AIDS conditions, some body immunity powers is goes down. Okay, and it is infected by the various diseases. Okay, because the resistance powers of the bodies become less, means it reaches to the zero levels. So at that cases, any infectious diseases, okay, or any diseases associated with the atmosphere, okay, associated with the pathogen, associated with the bacteria and viral infections, the patients can be attacked by these diseases. So at these conditions, patients can be suffer by the bronchitis also, pneumonia also, tuberculosis also, okay, uh, mineral diseases also, cancer also. So it is become a chronic in this case due to the having the low resistance powers or zero immunity. So symptoms of the AIDS are the manifested by the enlargement of the lymph glands, tiredness, fever continuously, consistently fever is there, loss of the appetite, loss of the weights, nausea, diarrhea, insomnia. These are the important symptoms of the AIDS. The AIDS virus infection may also be spread. Okay, it may also be spread to the central nervous systems and the brain, causing the loss of memory also. Okay, to the central nervous systems and the brain, causing the loss of memory and the coordinations. Loss of the coordinations means हाथ क्या कर रहा है सर को पता नहीं रहता है, okay? बॉडी क्या एक्शन कर रही है हमको पता नहीं रहता है. दैट इज अ loss of the coordinations in between the central nervous systems and the peripheral nervous systems. दोनों के बीच में कोऑर्डिनेशन यहाँ पर जीरो हो जाता है. ये है about the AIDS. Next is the what is the cancer and what are its causes. We have studied some things about the cancers, types of the cancers. Generally, cancer is defined as the unorganized growth, okay, uncontrolled growth of the cell in the body, in which the controlling and the at the same times, okay, regulating mechanisms have disappeared. So at that times, it is difficult to body, okay, to adjust with the disease conditions, and it persists for the long period of the times. In the initial state, we cannot identify the it. Okay, very few people can be identified by performing the test. In the maximum cases, it is hidden process. Okay, continuously last for the last step, and at the last step, generally we do the test and we find out the tumors or the any enlargement part of the body. At that times, detections of the third step of the cancer is identified. So generally it hidden for the until the last step. Very few people can be identified these changes. So regulating mechanisms have disappeared. Okay, have become ineffective. What are the causes of the cancers? I think you all know the carcinogenic agents are the main causes of the cancer. Okay, and carcinogens can be from the chemicals also, from the tobacco also. Okay, carcinogens are the responsible. Some of the X-rays or the gamma rays also responsible for the cancers. Okay. The exact cause of the cancer is not known. However, several factors are known to be the cancer producing or the carcinogenic. Example, it may be caused due to the some genetic disorder which may be the transferred from the parent to child. Exposed to the radiations like the X-ray or the UV rays is also responsible for the cancer. Okay, environmental pollutions due to the smoke or automobile emission, industrial influence, etc., chewing of the pans and tobacco as well as smoking cigarettes is also responsible for the cancers. So we all know the causes of the cancers. Next is the what is amoebiasis. Okay. Some terms regarding the amoebiasis we have learned in the metronidazoles. Next question is the what is amoebiasis and what are the types of it. Generally, amoebiasis is an infectious disease, okay, caused by the protozoans Anti-Amoeba histolytica, and its primary affects the colon, but the other organs may also be affected in the secondary stage, like the liver, lungs, and the brains. And there are two types of the amoebic dysenteries. One is the amoebic dysentery associated with the bloody mucoid stools and abdominal pain under the acute condition. Chronic amoebiasis is characterized with the vague symptoms like anorexia, abdominal pain, okay, intermittent diarrhea, or the constipations are also associated with these diseases. So this is about the amoebiasis. Okay, two questions were asked on these points. One is the separate question of the metronidazole. Another question is the for the anti-amoebiasis. Next is the structure, uses, and side effects of the paranizamide drugs. Give the structure, uses, and side effect of the pyrazinamide drugs. So, firstly, we have to draw the structures. Okay, structure is given here. Structure is a given here having the two nitrogen atoms. So, firstly, we know that the what is in which category this pyrazinamide drugs comes under. In which categories we include these drugs? This is the important types of the drugs. Pyranizamide. Pyra means indicating that they are containing the nitrogen atoms. Okay. Pyranizamide means the containing the nitrogen atoms. So in this category, it is generally used for the treatment of the anti-tuberculosis or the anti-leprotic type of the drugs. Anti-tuberculosis and the anti-leprotic types of the drugs. So generally what happens in the tuberculosis conditions, okay, the tuberculosis responsible for responsible due to the it is responsible due to the bacteria, okay, bacterial diseases. So in this condition, pyranizamide, that is the pyrazines types of the drugs are generally used. So it is active against the streptomyces and isonidazole resistance strain of the Mycobacterium tuberculosis. Okay, it is also this drug also known as a pyrazine. It is the carboxamides. It is the white crystalline powder and it is sparingly soluble in water and slightly soluble in organic solvents. So anti-tuberculosis drugs, it is a sprayed, okay, bacterial infections. It is used for the treatment of the tuberculosis as it has the tuberculoid activity and the short term activity. Each drugs having is some of the side effects also. So at the same time, the paranizamide is also having the side effect of the nausea, vomiting, rash, urine retentions, and in some cases fever with the jaundice is also there. Okay. Next is the what are the characteristic of anti-TB drugs? TB, tuberculosis. Okay. The drug which are used for the treatment of the tuberculosis are known as the anti-TB drugs. Drug used for the tuberculosis is known as anti-TB drugs. It should be possess the following characteristic. It must be the highly diffusible and able to reach all the tissue including the meningitis and the brains. It must be effective in different biochemical environments. It must be the relatively non-toxic in the therapeutic doses and the toxicity should be remain low. It must be relatively stable for the reasonable length of the times. So these are the some of the important characteristic should the tuberculosis drug show. Next is the explain in brief the different forms of the carbons, that is nanoparticles. The carbon nanoparticles have different physical forms called as allotropes. They are important allotropes are the one of the allotrope is diamond. Okay, सबसे important है एक allotrope diamonds जो कि प्रीसियस वन है. बाकी एलोट्रॉप किसी को पता है कार्बन के कौन कौन से होते हैं तो हम्म, बाकी के एलोट्रॉप्स के बारे में पता है कार्बन के एलोट्रॉप्स को तो
Graphite.
graphite is also one. Yes, graphite is also the one of the important allotropes of the carbons. Okay. डायमंड भी एक उसका एलोट्रॉप है, ग्राफाइट एक एलोट्रॉप है और कौन सा है फोल्ड्रीन इज द वन ऑफ द important allotropes. Okay, graphite graphene is also one of the important allotropes. So diamond जो है it is a extremely hard substance having the macromolecular structures. इसको कट करना बहुत difficult है diamond को. It has a networks of the covalent bonds between the tetrahedral sp3 hybridized carbon atoms. It is hard. It is the insoluble solid having the very high melting point and it is a non-conductor of the electricity. Next is the graphite. It is also the macromolecular having the layer type of the structure. Each layer has a fused six-membered rings formed by the covalent linkage between the sp2 carbon atoms. Okay. These are the two allotropes. Next is the fullerene is also one of the important allotrope, that is they are the definite molecular species having the molecular formula such as the C16, C17, C540, etc. They consist of the 5 and the 6 membered carbon rings formed by the covalent bonds between the sp2 and sp3 carbon atoms. Fullerene are the low melting soft solid insoluble in water but soluble in alkyl benzenes. They are non-conductor of the electricity. Next is the carbon nanotubes. It is another allotropic form of the carbons having the elongated tube-like structures. The wall of the tube are made up of the six-membered rings obtained by the covalent bonds between the sp2 carbon atoms. The diameter cylinder is also about the nanometers and hence the nanotubes are used. Okay, so give the structure and the uses of the. This is the next point. So we will cover this next points in the next lectures. Remind this all these points which we have studied in today's lecture.